Welcome back to Crack the Cure series with me, Kavya Tendral. If you have not subscribed our channel, please do subscribe for more interesting videos. In today's session, we will be seeing about the common sites of bone tumor and the age of onset. First, we'll see the common sites of bone tumor and then we'll move on to age of onset of the tumor. At last, a quick recap. As far as bone tumors are concerned, we're now going to divide into a flat bone tumor and long bone tumor. As far as flat bone is concerned, whenever someone is asking us to say the names of a flat bone, we'll start with skull, scapula, and sacrum. One peculiar thing about all these names is it has C and as well S. With this, we are going to remember like C for chondro and S for sarcoma. Thereby, the common tumor in the flat bone is chondrosarcoma. Next, we come to the long bone tumors. In order to remember this, we have divided into epiphysis, diaphysis, and metaphysis. In epiphysis, we'll remember just it has a chondroblast to lamellar bone formation, chondroblast and bone. In diaphysis, it is the osteocyte, and in between we have the medulla, within which we have the bone marrow. At last, in metaphysis, we'll consider three components: M for M, that is the muscular component, then the chondrocyte and the osteocyte. A tumor which is arising in the epiphysis of a long bone, it could be of chondroblast origin, that is chondroblastoma. If it is of bone origin, it could be osteoclastoma. This osteoclastoma will also involve the metaphysis apart from epiphysis also. And we are more familiar again on this chondrosarcoma because this chondrosarcoma is usually common in flat bones. If at all is occurring in the long bones, it could be in the epiphysis. Coming to diaphysis, for our comfort of remembering, we divided into bone marrow and osteocyte. Bone marrow, we know it is all a collection of progenitor cells for RBC, WBC, and platelets. In that way, if at all a tumor which is arising from that bone marrow per se, especially a plasma cell tumor, it is a multiple myeloma, small round cell tumor, Ewing sarcoma, lymphoid tumors, lymphoma, and adamantinoma. We remember adamantinoma like DA and DIA. It is similar. So, adamantinoma is also a tumor of the diaphysis. Di means two. So, in osteoma, the ost is repeating twice. So, we'll consider this osteoma to be a tumor in the diaphysis. Then coming to metaphysis. In metaphysis, we have three components. So, muscle component, chondrocyte, and osteocyte. Now we are going to take the probability like what we do in mathematics. So muscle and cartilage, chondrosarcoma. I've already said this chondrosarcoma can occur in epiphysis and as well in diaphysis. Next, coming to cartilage and bone. So chondrosarcoma is completed, and next to that is osteochondroma. Next is osteosarcoma, and then is the enchondroma, that is encapsulated chondroma tumors in metaphysis. At last is the bone cyst, aneurysmal bone cyst, another bone cyst which is common in the metaphysis, bone cyst. Next, we'll move on to the common age of onset. As far as common age of onset, we have collected some important diseases, of which the first is aneurysmal bone cyst disease. So, aneurysmal A, B, C, D. The age of onset of this disease is 40 years because it is four letters, so remember like around 40 years. Then enchondromas, we'll take in Tamil. So என்றது, when we are trying to count in our hands through using fingers, so we connect this enchondroma and fingers. This enchondroma tumor is going to arise in the fingers, first point, and the age is When we are going to count the uh, money is when we ourselves work and earn our own money, and that period is 20 to 30 years. Yes, this enchondroma is also occurring at a period of 20 to 30 years. Then coming to chondrosarcoma, we are more familiar that chondrosarcoma are common in flat bones, FLAT flat. So 4 letters. It is a around 40 years it can occur as a median age. Next coming to multiple myeloma. Mnemonic for this, முயல் முயலுக்கு 3 கால்னு சொல்லுவாங்க. நான் பிடிச்சவங்களுக்கு 3 கால், ஆனால் இல்லை அதுக்கு 4 கால் இருக்குது. ஸோ இட் இஸ் again 40 years, but to say it is actually above 40 years. Multiple myeloma is above 40 years. Next, osteoblastoma, osteoclastoma. Although these two sound same, the difference is B and C. On the alphabet, B is 2, so it is like somewhere around 20 years, and C is 3, so somewhere around 30 years. It is the age of onset. At last, adamantinoma. We'll remember adamant. A child will be adamant, especially in the early age of adolescent age, like 10 years. So this tumor can occur in 10 years to 25 years. Now we'll come to a quick recap. Chondroblastoma. So a blast component, it could be an epiphysis tumor. Again, osteoclastoma, it could be in the epiphysis and as well in the metaphysis also. So we have done. Next is chondrosarcoma. Chondrosarcoma is although it is very common in the flat bones, in long bones it can occur in the epiphysis. We have done. Next, osteochondroma. So that is bone and as well cartilage. So it is a tumor in the metaphysis. Then bone cyst, again metaphysis. Then enchondromas, again it is a metaphyseal tumor. Osteosarcoma, a metaphyseal tumor. Coming to Ewing sarcoma. Ewing sarcoma is a component that is a small round cell tumor, so it should be in diaphysis, that is a medulla part. So it is again Ewing sarcoma is a diaphyseal tumor, lymphoma is a diaphyseal tumor, multiple myeloma is a diaphyseal tumor, adamantinoma a diaphyseal tumor, and osteoblastoma a diaphyseal tumor. That's it. Thank you so much for your patient listening, and these are my references.